Now, new research into the health behaviours of school-going children has revealed the shocking figure that 1/5 of Irish children go to bed hungry, showing an increase of 4% since 2006.
Other findings revealed little improvement in the amount of exercise children take today, but showed a decrease in tobacco, alcohol and cannabis use. This morning we're discussing the findings with one of the survey's senior researchers, Dr. Micheál Mulholland, and Senator and former CEO of the Children's Rights Alliance, Jillian van Turnhout. Good morning to you both.
Good morning.
Thank you for joining us. Micheál, can I come to you first, because you're one of the survey investigators. Before we discuss the findings, which of course are very interesting, there's 43 countries take part in this, and this is in collaboration with the World Health Organization. So what's the purpose of it?
Well, first of all, it's a very old study, if you like. It started in 1982, so we're celebrating 30 years this year. The purpose is to monitor children's health across Europe and North America over the years. This is really the purpose, and very much it is a policy oriented study, because what we want to do is to influence policy making.
Okay. And is it a representative sample right across the board?
It's over 16,000 children. It is representative across all geographical areas and all ages that we sampled. This is 9 to 18, absolutely, yes.
How many of those children were Irish?
All of, well, majority.
All right, so it's...
Oh, it's 16,000 is in Ireland.
All right,
overall,
okay.
we're talking about a few 100,000.
Right, so let's go to the I suppose, the headline stat, the one that everybody picked out. And it's kind of misleading in some ways, but you can explain why. 1 in 5 children, Irish children, going to bed hungry. Now, if that was from what you would call lower socioeconomic strata, then you would say that obviously is an indication of the economic state of the country. But this is from across the social classes, so it's not about poverty per se, is it?
It's not just about poverty. When I came to Ireland in 2005, and I've looked at the figures of 2002, which we first reported. There were 16% reporting going to bed or to school hungry, which is quite surprising. So we went the kids back and asked them, how could they explain that to us? Because for me, it doesn't make sense. The children were not surprised, which in itself was a surprise. And they said, yes, some of the kids are poor, other is to do with, maybe parents are not shopping, maybe don't prioritize making the food, maybe the food that's at home is not ready for them to eat, so it's not accessible for them. And for them, it means there's no food. We did ask them if that could be with them being on diet, and said, no, that's not the question. The question is going to bed or school because there's no food in the house. And we asked them if that could be because of, food choices. There was nothing that they liked, and said, no, the question is actually very clear. So, no, it's not just about poverty. It's a bigger issue. It's more complex.
I do think it's very upsetting. I read in the notes here that one of the children said something along the lines of they would go to bed just to get rid of the feeling of hunger. I think that's so upsetting.
That's not from our survey, but...
Is it not? Okay, no. It's from one of the articles I read around the survey. But I think that's so frightening, isn't it, from a child's perspective?
And I think also if you talk to teachers in school, the fact that the children going to school hungry, their ability to learn is reduced because they're hungry. All of us as adults, when we're hungry, we don't concentrate as well. It disproportionately affects children. So it's all those knock-on effects.
Jillian, though, we are in danger of losing sight of some of the more positive aspects of this by concentrating on that one headline, which is again slightly misleading because, as I said, it's not strictly about poverty. It's about lifestyle and about how they're being taken care of, which is a different issue. The most frightening statistic I saw, and possibly is because I've got children in that age, is that 25% of those aged between 15 and 17 are having sex. And the only thing that gives me any consolation in that is that 93% of them said they are at least using a condom the last time they had, and over nearly 60% are using birth control. Now, 1 in 4 teenagers between 15 and 17 having sex for a parent with children in that age bracket is something that would scare the daylights out of me.
Yeah, and certainly when I first saw the figure, I was taken back by the figure. But actually, if you go into the classrooms and if you talk to young people, if you're working with young people of that age, they are experimenting with, their hormones are developing, they're growing, so they are experimenting. So also I would wonder sometimes on the definition of sex, maybe, or adult. And I'm not in any way discounting the research, but it's their definition.
And you have to put factor bravado in there as well.
Exactly, and you have to, I was saying before we came on to Micheál that when I was at school in 6th year, if you asked most of my class, they said they were having sex, and I thought I was the only one not having sex. When I left school, I realised that the majority of my class had never had. So, I'm not being, but I think in Ireland we need to have a proper discussion about awareness of relationships and that whole, that sense. And I think we only ever talk about the age of consent and a physical act. And that's not what it's about.
No.
And I think that's where you as a parent is coming in, because you see that wider context.
Well, I do, yeah. I have a slightly more old-fashioned attitude to dealing with it, which is just lock them up until they're 30 and it doesn't become a problem.
So, I would say, though, that in terms of the definition was full intercourse, so it was very clear.
Yeah. Okay, Michal, another actually quite uplifting statistic was the decrease in smoking and drinking and recreational drug use, which in one sense kind of flies in the face of what you think is happening with modern life. So are our kids being smarter than we're giving them credit for?
I think so. First of all, I think overall the results are really encouraging. The overall results that we presented. Yes, I think that kids are responsible. Yes, they're having sex, but they're using condoms. And, you know, 93%, it's a very high percentage. It's brilliant.
It is very high.
They are experiencing fine. At least they're doing it in a safe way.
That caution or that sense, is that because of the amount of information that is available to them through laptops, computers, internet and all the rest of it? Are they taking this information on board themselves, assimilating it and making good choices as a result?
I think that, first of all, there's a lot of work done around substance use, in Ireland and globally. And I think children are smart. Children understand. I think we don't give them enough credit. I think there's a great generation growing up. Globally, really, they have access to information that we didn't have when we grew up. And they
there's
seem to
excellent
be using
campaigns
it.
out there, isn't there, for sexual health now and, you know, protecting yourself?
But I think there's also a role, certainly when I was, you know, reading through the research, I think for me, certainly the words protecting childhood came up for me. And we actually have to make far greater efforts in protecting childhood, allowing children to be children. And I think we have this urge for them to grow up too quickly. And, you know, if I look at the code that the Minister for Children is bringing in about the retailers, about what they can wear, and, you know, all of this for me is to look at how we protect childhood. And that's where, for me, looking at this research, we need to draw the lessons and actually say, what can we do to improve lives for children? Do we talk about breakfast clubs in schools? You know, let's really get to the heart of the issues.
Well, look, initially, thank you very much for coming into us at this hour of the morning. It does seem as if we're raising a generation who seem to be able to protect themselves or seem to be better at doing it than we were. For the time being, thank you both very much indeed.
Thank you very much.
Now,